Alright, for those of you who don't know me, my name is Jennifer Engel, and today actually marks almost, like in 5 days, that I've been on hospice for 11 months. We're moving into October, can you believe it? And the reason why I've been able to be on hospice, and I have notes, by the way, so I'm going to be looking down and reading my notes, and also looking up at the camera as well, because I don't want to miss anything. There are a lot of notes here. I have like 15 pages of little sticky notes. And at first I'm going to talk about my update, and then at the end I'm going to give some tips basically for anybody. So you can use this as like a podcast. Just listen to me while you're walking around or whatever, or however you want to use this video, if you do want to actually watch it or not. But I do this just to keep people updated on how I'm doing. Alright, the reason why I've been able to be on hospice, and I've said this time and time again, is that I had a lot of weight on me when I started 11 months ago. I was like 165 pounds or something, and now I'm down to 100, I think. Because to be honest, I haven't weighed myself in a week because I think I'm a little scared to see if it's actually gone under 100 or not. But maybe I'll do that soon, just so that I know. So again, this is my Wednesday weekly update. For now, I'm going to talk about the physical changes that have happened since last week, and physically and emotionally. And what I'll do is I'll start with physically, I'll do the cons, and then I'll move into the pros, and then I'm going to talk about mentally, and then I'm going to give some tips for anybody. Alright, so let's start with physically. There might be pauses because that's where my notes change. So my left hip, my lower back, and the signals from my brain to my feet have really atrophied to the point where I can only walk like a little bit, and I need to walk mostly with assistance. I use 2 canes to help me walk so I can only really walk from like my chair to my sofa, or from my bed to the bathroom. And generally now I have someone behind me using something. This is what I bought. It's called a gait belt, and I'll show you what that is. Most of the time a gait belt that hospice will give you is literally just a piece of fabric that you put around your waist and someone can grab. I decided that wasn't the best, so I went on to Amazon, and for $10 I got a better gait belt. This is what a gait belt is. I didn't know what it was until my caregiver talked about it. So what you do is you put this on yourself, and then someone has a handle to kind of guide you so that you don't fall over. I like this one because it has handles on either side, and it even has, I think it has handles throughout the whole thing. So this is really handy. Someone can kind of grab me from the back while I'm walking, so if I do start to fall, they can catch me. I like the side handles because I can't really get up the steps anymore on my own. I definitely have to have some help, especially the last 2 steps and they're only 5 steps, by the way. The other thing is they can kind of pick me up and lift me to help me get up those steps. So that's kind of one negative. So I would say, and I'm not good at math, that I can probably walk 10 feet or less on my own without someone technically holding me. But after that, it is nice to have someone behind me, because if I'm going to fall, I learned I'm going to fall backwards. So that's one thing that's kind of a con, because it's an atrophy and it means I need a lot more help. Let's see. Yep, talked about that one. Hospice, you can get the gait belt from hospice, but the problem is they're just a strap. They don't have these handles, and it's almost like a back brace too. So I found this one on Amazon for $10. I would highly recommend getting it on Amazon rather than through hospice, but hospice can give you one that's kind of less quality, but it's free. So there we go. Another con is that I'm dry all the time, and that's because I'm on steroids like 5 times a day, and that's to help me breathe. So anywhere I go, I have a lot of water or Gatorade sitting in every place that I might be, because I need to kind of keep drinking and moisturizing. It really leaves your mouth dry and your nose, and you can get a bloody nose more often, so that's kind of a negative. I think I've talked about in the past, one thing I do for bloody noses is make sure it's gone, but then I line my nose with some Vaseline, and that helps as well, and just staying hydrated. The other thing that I've done is I'm wearing what I call pull-ups, and I guess the politically correct term is briefs, but I'm the patient, so I can call them pull-ups. The reason why is just in case. So just as I had the oxygen for like a safety blanket, I'm using these briefs like a safety blanket, because in the summer I experimented with the soft foods and what I call bedside enemas and mushy foods, and that actually caused my system to work kind of normal. And the problem with that was that it also made me incontinent. I didn't know when I was gonna go. So in the summer, I had some times where I was running to the bathroom. Well, I can't run to the bathroom anymore. I will fall. I will hurt myself. So I'm not ashamed to say that I've moved into wearing briefs just in case. Luckily, nothing has occurred in those briefs yet, because I'm able to go to the bathroom on my own. But again, I would rather be prepared than not. Let's see. Yeah, talked about that. All right, the other thing I've moved into, and this is where actually, if you don't know, I have an ostomy as well. I've had it since I was 4 years old, because I also have spina bifida. It's a mild form of spina bifida, but it did not affect me or my family mildly. So I am going to show you actually the ostomy and the hookup system that I have, because if someone is on hospice and they don't have an ostomy, there is going to be something similar. At night they can get I can't say it, like a catheter that will also hook up to a drainage system that might be different but similar, so that you don't have to get up and go to the bathroom at night. And then those people who are on hospice will also, or just end of life, which could also be hospice, they will also have to start wearing briefs during the day, because they will also start to become incontinent. So I'm going to pause the video for a minute and flip the camera and kind of show you some things. Alright, I don't know if I've ever shown my ostomy before, but this is what it is. I have a stoma, and that's where the urine comes out, and then I have a bag that it collects in, and then this will go all the way down to a drainage. Alright, so that can actually kind of be a pro and a con. Growing up, I saw my ostomy as a con a lot, but now at end of life, it's actually kind of paying off. Alright, so now I'm still going to move on to the cons. And this one really isn't a con. It's kind of a pro and a con, so it's a really good transition. One kind of the med adjustment that we made is I went on to just liquid morphine to a 12-hour release morphine. And I thought, so I know that opioids really don't do well with my system, especially fentanyl. Oof. I put it in my notes, my nurse notes, that fentanyl has a really bad side effect for me, which is severe nausea. So the nurse put that in the notes for me this week. But what we did is we tried to go low and slow. So I tried one of the 12-hour releases in the morning, and that actually worked pretty well. So I thought, okay, let's move up to the 2, which is what you're supposed to take because it's every 12 hours. 1 in the morning and 1 at night. So I tried that, but man, even that really messed up my signals and made me mildly nauseous. No, it actually made me more nauseous, not just mildly nauseous. So what I did is I started to experiment with how I can actually use these medications, which lets you know that you don't have to always follow what the doctors and nurses say how things are supposed to be taken. What you really want to do is problem solve for how these medications can work for you. So what I've decided to do is do 1 shot of the liquid morphine, which is actually very little. It's only like this much, 1.0. And I use that to get through doing what I call my medical things. I have to do an enema every day. And what I do is that 1 shot will help me try to alleviate some of the discomfort that I feel while I'm going to the bathroom, because my butt is very, very bony right now. So even just sitting on a toilet seat can be highly uncomfortable. Sitting on a shower seat can be a little uncomfortable because I literally have no cushion. But I have to choose, because what was happening was when I was taking 2 of what we call the extended release morphines, it was basically blocking all of my signals, because that's what it's supposed to do. It's supposed to block the pain signals. But it was also kind of blocking, my ability to register in my mind and in my spine and in my stomach that I had to go to the bathroom. And so I was having trouble going to the bathroom. So I have to choose between a little discomfort and being able to go to the bathroom, or not as much discomfort and not going to the bathroom. Well, that's not a choice for me, because for me, digestive is everything. It really affects your mood greatly. So again, what I've decided to do is problem solve. And I take 1 shot of this, which helps a little bit, but it doesn't mess up my signals. And then, because I am probably in quite a bit of discomfort, after I do my medical things in my shower, then I take the 12-hour release pill, which will cover me from like noon to midnight. So problem solve. That doesn't have to be for someone just on hospice. That can be for anyone who's dealing with any medical issue. Use your voice. Experiment. Problem solve until you find what is most comfortable for you. Let's see here. So I did that. I think I covered a lot of these right now. So, yep, I did that one. We're cruising right along. I did that one. Okay, here's the next one. This is where it starts to get into the pros of what's been happening. So people used to say that morphine helps with breathing. Morphine helps with breathing. And I'm like, no, it doesn't. Not this little 1-shotter. But what I have found is the 12-hour release does help with breathing, not breeding. I'm done having children. Because I don't need that oxygen 24/7, which also helps prevent the bloody nose because I don't have that air blowing on it constantly when I'm already dry. So that's a pro of the 12-hour release, is it does really help with comfort and with breathing. All right. Another pro, my bed. It was screaming at me every time I would lift either my feet or the backside. And what a pro is hospice will cover repairs. So we did have a guy come and repair my bed, and now it's quiet. So that's a pro. My breathing is good, probably again because I mentioned that 12-hour morphine release. I got some good data today from my nurse visit. All my vitals are actually pretty good. My right lung is clear. My left lung, at the very bottom, there is definitely some, I don't know, probably where the nodes, probably where the nodes are growing. There is a little difficulty in wheezing. That hasn't really changed. So the good data is that I've always worn my oxygen when she was here. So my oxygen saturation was and is like 98% when I do wear the oxygen. And we found out today it only drops down 4% when I'm not using oxygen, which is still pretty high. It's 94%, so that's good. My breathing has improved. Surprisingly, my mental and emotional health is still really good. So how and why can I keep up positive mental health and feeling good and nice when I'm declining and I'm probably getting closer to the end of my journey? And this is where I also think tips can help other people, whether you are on hospice or not. We all have problems, okay? It isn't just the Jenny show, and it's everybody's show. All right, here's how I do it, or how I think I do it. So the first thing is I've done a lot of releasing. I think I've told people every time I have a wave, which I consider like emotional sadness, mourning, whatever it is, I face it right away. I don't ignore it. I go through it, and I let other people now see me go through it, because I think that's important for other people to see how you handle problems. Also, because I have problem solved, and that's kind of what I was talking about when I was talking about you don't have to just listen to what the doctors say. I mean, it's good. You can listen to what other people say, but then try it out on yourself. And if it works, great. Use that advice. But if it doesn't work, problem solve how it will work for you. Just like I do a shot of liquid, even though it might not be as effective, but it is more effective for one of my goals, which is being able to go to the bathroom. And then I take the stronger one after. So problem solve. Also, I've done it by being prepared beforehand, physically and mentally. Physically, I buy what I think I'll need, even before I need it or as I need it, like the gait belt. Let's see. Yep, I talked about the gait belt, so we don't have to talk about that anymore. All right. Mentally, I use visualization, in which I choose to be intentional. I could choose to be depressed and atrophy and decline. I can choose, or I can choose logic. This is just the cycle of life. At some point, we all return back to babies, although there are other ways to pass, like a heart attack and stuff. But it is the cycle of life. And if you have what I have and you let the process develop naturally, we turn back into babies. Babies basically need diapers, they need food, they need care. That's what happens at the end of life too. I can use humor, you know? Like, when I was a little bit nervous and having waves and mourning a little bit at losing control of my body, my caregiver is like, you know what? I've been told I'm the best ass wiper, and we're going to treat you with respect and care. And, I can just choose to use humor. Sometimes I use humor to people who are on the outside of this journey would think is almost horrid. It's like, well, I'm going to die anyway. Who cares, But that's just how I cope with a not so pleasant situation. I use humor. The other thing is to just let go of control, which is not always easy. That's very hard for me. But there is a lesson to be learned in letting go of control and allowing others to do things for you. So be willing to let go of control, but also learn the lesson in that as well. In our Western society, we're so like, you have to do everything. You have to be independent. And in some cases, that's true. There are pieces where we need to take responsibility for what the universe or whatever has given us, right? But then there are other times where we need to let go. And we need to trust the other people around us. And if we can't trust the people around us, then we need to find the people that we can trust around us. So I use humor, letting go, and just learning the lesson. So in conclusion, yes, I am atrophying. Not as much left. What do I mean by that? Oh, I think I mean more on my left side than not as much. I'm atrophying where the signals to my brain are, and just the physical power of my feet and of my hips and my lower back. So I'm atrophying. It's almost like I'm moving from my feet up to my hips, and who knows what will happen up in here. A little bit in my stomach, especially my left side. So it's like I'm almost atrophying bottom up. But the good thing is that I still have good upper body strength, good cognitive abilities, good mental health. And I do this by being intentional and choosing to, and this is what I think can help other people, plan and prepare ahead of time, using visualization, choosing to use humor, logic, and learning, and the lesson of letting go, which again is something everyone can do. You don't have to be on hospice. So what I want you to do is I want you to think about one problem in your life. Learn why that's a problem. Then think of possible coping strategies to deal with that problem. Then make a plan. Pick up the items needed to make that plan work. Then visualize how the plan and products will work positively and by using humor or having fun, or how the products can lead to create more comfort and peace in your life. I hope, because, sorry, I'm starting to get a little dry, because the world really needs a lot more comfort and peace, and it needs you.